Hello and welcome to the Hospital Management Asia webinar session. The session today is entitled Improving the Patient Experience and Outcomes with the Language of Caring. Today's session will be presented by Ms. Wendy Leebov. She is an author, thought leader, and expert on improving the patient experience. Just a quick reminder, if you have questions, you can type it in the chat box on the right side of the dashboard on your screen. Ms. Leebov will answer your questions at the end of the presentation. And now, to start the session, please welcome Ms. Wendy Leebov.
Thank you very much, Rose, and I'm honored to be talking with you this morning and hope that you find this webinar beneficial. Improving the patient experience. I've been working at this for about 35 years here in the United States, and I understand we face some similar challenges to, as you do, in the healthcare system in your country. So in my work world, our company partners with healthcare organizations around the world to create and sustain healing experiences and positive outcomes through powerfully effective patient and family-centered communication. Our focus is on communication quality. And of course, as you know, we have a lot at stake in improving the patient experience. We have our patient care mission. We all, I'm sure, aim to provide comfort, healing, and support to the people we serve. We aim to earn patient and family loyalty and a reputation for excellence and compassion. We yearn for professional gratification, which tends to derive from satisfying relationships with people. So communication is critical. And we certainly aim to provide optimal performance and quality patient outcomes. We want all of these things. That's what's at stake. Well, healthcare organizations, in order to improve the patient experience, follow what I consider to be two major strategies. One I call a shotgun approach, and the other is analogous to bowling. With a shotgun approach, people set one objective after another regarding the patient experience and keep trying to change one thing after another. So they might focus on improving responsiveness when people need help. They might focus on reducing noise. They might focus on explaining medications more effectively. They might focus on co-worker relationship quality, and physicians and nurses working hand in hand. So they might adopt and pursue a series of patient experience objectives, one after another. And now the problem with that, you certainly can achieve gains, but it's hard on the staff because it can overwhelm them with many initiatives all at once. Now, what's the alternative? The alternative is what I call a bowling approach. And you know, in bowling, if you throw the ball and you hit the pin, in the front pin in a sweet spot, it affects all the other pins. And so you're just aiming for one goal, but it has an impact on many other things. And that one goal that has this tremendous power in healthcare is focusing on caring communication. When we focus on caring communication, just as a single breakthrough objective, we affect everything else that we care about. Patient and family engagement. We improve patient safety. We engage employees more effectively. We improve our ratings on patient surveys. We get better patient outcomes. We reduce risk, and we improve teamwork. So when we focus on caring communication, we affect all of these objectives. So the bottom line is a focus on communication is pivotal and powerful. Now, caring is a given, but communicating caring is not. And some people believe that, but of course, we're already caring. And we certainly are caring, but that doesn't mean we communicate our caring in our everyday interactions. So this webinar is really about the conversations, the connections, the common language that we have that makes a difference in the lives of the people we serve. So now let's focus in on patients and families. What are they looking for in terms of our communication? What's going on in their hearts and minds? They're wondering, can I trust these people? Will they listen to me? Can I do what they expect of me? Am I capable of it? Am I safe here? Can I relax feeling their support? Can I get less anxious because the people around me are compassionate and caring? That's what's going on in people's minds. And as the Dalai Lama said, real care of the sick does not begin with costly procedures, but with the simple gifts of affection, love, and concern. So as I said, we have strong roots as caring people who want to make a difference, and yet these days we are so busy, loaded with busy schedules and multiple priorities. And while we care deeply, we run the risk of missing opportunities to communicate our caring to patients, families, and each other. If we don't communicate it, they do not know it's there. So in this webinar, I would like to introduce you to the language of caring, a language of emotional support, which people sorely need in order to offset all of the task-oriented communication, which is rampant these days in an atmosphere of busyness and pressure. And then after exploring and demonstrating the language of caring, I'd like to identify a few tactics that you can use to engage your team in using the language of caring skills in their everyday interactions. So first, focusing on using the language of caring to balance task-oriented communication with emotionally supportive communication. So consider this situation. A patient cries out to a caregiver, "I'm in terrible pain, I want more medicine now." Ask yourself, what would be your first response? Without much thought, what is the first line that you think you might say? And hold that in your mind. Now let me explain a communication model, and then go back and ask you to refer again to what you think you would say if someone cried out to you in pain. As I see it, there are two kinds of communication. There's heart communication and head communication. Heart communication is about emotions, caring, and empathy. Head communication is more cerebral, more rational, and it's about tasks, information, analyses, solutions, fixing problems, explaining things, and making plans, giving options. So the more rational side is head communication, and the more emotional side is heart communication. So again, these days, busyness and pressure, the fact is, make us mainly task-oriented, and we communicate much more and much more often from the head and much less from the heart. And the result, patients and families may view us as uncaring and not tuned in, even though we are caring on the inside. Now consider that example I gave you. The patient cries out, "I'm in terrible pain, I want more medicine now." When people respond from the head to that patient, they might say things like this: "How would you rate your pain from 1 to 10? Or, "You can have more medicine in about 20 minutes. Or, "It's not time for your medicine again. You'll have to wait." Or, "Well, tell me, where is the pain exactly?" Or, "I'll check with the doctors to see if there's something else I can give you." So these are all responses from the head. A person saying these things is trying to fix the problem. They absolutely mean well. They want to get to the root of the problem and fix it. Or they want to inquire more about the pain, learn more about it so they can fix it. Now, in contrast to head responses are heart responses. And here's what those would sound like. "I'm so sorry you're in pain. This must be so hard for you. I want to help you so you can feel comfortable." So you feel the difference, I hope, between the head responses and the heart responses. The heart responses are emotionally supportive and show empathy. Now, both head and heart have great benefits. When we speak from the heart, patients, families, and coworkers feel important. They feel cared for and understood, and they can absorb the head messages much better. When we speak from the head, people get valuable information, and they appreciate our answers and our solutions. So what is the ideal? The ideal is a best practice that I call the heart-head-heart sandwich. Now, I know the idea of a sandwich is sort of a gimmicky thing, but this helps people remember that to mix heart with head messages, and in fact, to do so in a 2-to-1 ratio, more heart than head messages. Now, going back to the patient in pain, how would a heart-head-heart sandwich sound? So the patient cries out, I'm in terrible pain, I want more medicine now. So you might say, I'm so sorry you're in pain, I want to help. So let me talk to the doctor and see if there's something that might work better for you. That's the head part. And then end with, I really want to ease your pain. So I hope you can hear, you can feel how much more supportive that would be than just going for the fix to the problem. Instead of saying, oh, you're in pain, how would you rate that pain from 1 to 10? Or tell me, where is it exactly? Because that's as if, you know, the person is a series of you know, issues to solve rather than a person with feelings and distressed feelings who want first and foremost empathy. Now, you can't stop at communicating with heart. You also, of course, need to go for the solution, but without expressing heart messages, people may think you, in fact, don't care. Now, look at another example, because this applies just as well to our own families, to coworker situations. Let's say a coworker says to another person that they work with, these people are always complaining, I'm so sick of it. A heart message to begin with might be, it is maddening when you do all you can for people and they're still not happy. And then the head, and here's the head part, what complaints are you hearing? I wonder if there's something we can do to prevent them. And then end with caring again. I'd like to help you get less stressed and feel the respect you deserve. Now, this is a real different response in that situation than getting hooked or tied up in, you know, sympathizing. Yeah, isn't it awful that all these people complain and, well, you know, and ranting about that. So you have a very caring alternative to getting engaged in discussion and debate about these complaining people. So that's another example of heart, head, heart. Have to, of course, allow yourself to not think about what else might have been going on in your mind. It'll still be there. You know, many of us have racing minds with our to-do lists flooding our brains. Well, in order to be present, we have to let that to-do list go to the back of our minds and focus in fully on the person at hand. The second language of caring skill, the second heart skill, is acknowledging feelings. And this involves using words to reflect back the feelings that you think the other person might be having. Now, you are guessing, because frequently people aren't saying what they feel, but you can sort of read into their words and their nonverbal behavior what they might be feeling, and with this skill, you check out the reading of what they're feeling. So you, gee, I imagine this must be quite a relief for you. The fact is, people feel understood when we show regard for their feelings, not just for their words. So consider this nurse who says to a patient, how are you feeling today? And the person says, fine. Well, if the nurse is only listening to the person's words, that nurse might say, great, you're feeling good, good, and then they move on. But really, this patient did not sound like she felt fine. So when the nurse said, how are you feeling today? And the patient said, fine, it would have been so much more caring for the nurse to say something like, gee, you sound a little sad, or you sound a little down, so that she could help this woman open up and say more about what she was really feeling. So that's an example of acknowledging feelings and going beyond the words that someone is saying, and getting to the feelings behind it. A couple of examples. First, situations between two co-workers. So one says to the other, I'm so sick of Claudia calling off from work. She just isn't reliable. Well, some people would say, yes, isn't it awful, and it's how the nerve of her, and she makes it hard for all of us. Well, that just gets the two people both feeling bad, not really solving the problem, and the person on the receiving end of this just gets hooked into joining this negativity. So if you were going to, instead of saying, yeah, ain't it awful, if you wanted to use the skill acknowledging feelings, when the coworker says, I'm so sick of Claudia calling after him where she just isn't reliable, you might say, wow, you sound really frustrated with her. So you're keeping the feelings with the other person, but you're acknowledging in a kind and compassionate way the feelings that the person is having, because for them they're very real. Or consider the second situation. The patient says, oh, time for you again? I hate it when you come here because you always hurt me. So let's imagine this is a person coming to draw blood, and this man is not happy about it. So instead of saying, oh, come on, it won't hurt a bit or something like that, if the phlebotomist acknowledged his feelings, she might say, or he might say, gee, you sound so frustrated about having your blood taken. I'm going to be very, very gentle. Something that acknowledges the feeling. Now, the third skill is showing caring non-verbally. Now, look at this picture. Do these people sound happy? I mean, they're saying they're happy, but they sure don't look happy, because we tend to believe the nonverbal behavior of people even when their words say something different. Nonverbal behavior is very powerful. So let's say this person answering the phone says the words, I'll be with you in a minute. Well, you can say those words many different ways. You could say, I'll be with you in a minute, looking intent at the person like you really want to help, but you're distracted by the phone. Or you could say, I'll be with you in a minute, like you're angry and they're interrupting you. So the words could be the same, but the nonverbal behavior would really be what communicates the message. Now, there are some rules of thumb for nonverbal behavior, and one, because we can't adjust we can't know exactly how another person is going to interpret nonverbal behavior. So the best approach nonverbally is actually to match the other person's nonverbal behavior with our own. It's called nonverbal attunement or nonverbal alignment. Some people call it nonverbal listening. So we reflect back similar nonverbal behavior to the other person. So take the example of a person pushing a call button. They need help, and you're a caregiver and you're busy with someone else, and you need to finish with the other person before you can run into that other room. So it takes you about 5 minutes. And when you finally respond to that call light, you walk in a relaxed way and say, you called, how can I help? Well, the patient, after pushing that call button, probably had a sense of urgency, and they started counting the minutes or even the seconds, and they became impatient because they had a need, and they called for help. So every minute feels like an hour. So how could you show caring by your nonverbal approach to entering that room? And the answer would be knowing that people who push a call button tend to have a sense of urgency. It's ideal to walk into that room at a fast pace, looking intent and intense, so that your nonverbal behavior is communicating a sense of urgency that you believe matches the patient's sense of urgency. I mean, it's a little complex to explain, but the point is that we can take our cues from the other person nonverbally. If they're calm, be calm. If they're angry, don't be angry looking back, but rather look intense. Don't look, bored or indifferent. The fourth language of caring skill is explaining positive intent, and this is extremely difficult for people because caregivers, get into certain routines, and we're so used to what we do, we just assume that we're doing it for a good reason, but that doesn't mean patients and families know what that reason is. And so sometimes they're not cooperative or they might be resistant. So to explain positive intent, you explain how what you're doing is in the person's best interest. Make that explicit. Communicate how your actions are for their sake, not your own. So, for example, instead of saying, I'm closing the door, I'm closing the door to protect your privacy. To protect your privacy is your positive intent. And then people won't mind that you're closing the door. Or to a person who's complaining, instead of, getting defensive, the first words out of our mouths could be, I really want to help you. And that's going to, instantly calm the person down and enable them to explain what's going on so you can help them. Now look at the contrast between just doing an action with a patient, compare that to explaining the action, and then compare that again to adding a statement of positive intent. So first of all, you could cover up a patient with a blanket, which is a kind thing to do if you think they might be cold. Now, better yet, you could explain, here's a blanket. And better than that would be a statement of positive intent. Here's a blanket for you. I want you to be nice and warm. So you see, I want you to be nice and warm is the caregiver's positive intent, and that is going to show much more caring. Another example, you pull up a chair so a family member can sit down. Well, that's a nice thing to do, and they can see that you did it. It would be better to say, here, why don't you have a seat, which makes your action even more clear, and better than that would be to pull up that chair and to explain your positive intent. How is that for their sake? You're thinking about them. So you might say, how about a chair for you? I want you to be comfortable while we're talking. And a great tip, so easy, is to use the words for you and with you as often as you can, because for you and with you actually is a shorthand for explaining positive intent. So instead of, I'll tell you what you need to do, how about, I'd like to go over this with you, with everything that's important for you to do to make sure it's clear. Or instead of, let's get you scheduled, how about, let's get you scheduled. I want your next few appointments to be at a very good time for you. So the for you really drives home that it's really all about the other person. The fifth skill, the blameless apology. And with this, we use the magic words, I'm sorry, but we do so in a way that doesn't blame anybody for what's going on. We just use the words, I'm sorry, to show that we feel genuine, sincere regret that the person is somehow suffering. So, and the fact is that the words I'm sorry are magic words. People listen for them. We just have to be careful to use them well. And when we use them well, they are signs of strength, not weakness, and they mend our relationships. And they show caring to people. So here are examples of blaming apologies, which don't communicate caring. Gee, I'm sorry, but it wasn't my fault. So you said the magic words, I'm sorry, but you're being defensive about it and looking to whose fault it is, and the other person does not feel impressed with our caring. Or, I'm really sorry, everybody took longer today than usual. Well, the sorry was there, but this person is making other people look negative. It's sort of a implicit blaming of other people for not doing what they needed to do. And even worse than that is, gee, I'm sorry you had to wait. We're really short-staffed. I'm sorry you had to wait. That's fine, but we're really short-staffed. That makes the organization and its leadership, look incompetent. And the worst thing about it is it breeds anxiety. Because if you were a patient and you're at the mercy of an organization's staff, you don't want to feel like they don't have enough people to take care of you. So it's undermining, and people lose confidence. So these are not caring approaches to apologizing. In contrast, these are blameless apologies. I'm sorry this wasn't what you were expecting. See, nobody's being blamed there, but you're showing sincere regret. Or, I'm so sorry you were inconvenienced. Or, I'm so sorry it's exhausting to do these exercises. So you're just showing genuine regret that the person is somehow suffering. the sixth skill, the gift of appreciation. Thanks, appreciation, a compliment, admiration, and it's so powerful, especially when people aren't expecting it. So imagine this: there's a woman who's, sort of hounding you for results from a test on her father, and every time she asks for these results, you say, well, you're really sorry, but they're not in yet. Now, you can actually transform the situation by not getting defensive and not appearing impatient at all, but instead actually turning the situation into an opportunity to express appreciation for the person. So you could say, your father is very lucky to have you because you're such a wonderful advocate for him and really watching over him and taking a lot of responsibility for his care, and I really admire that. What a lucky man he has to have a daughter like you. And believe me, something like that, appreciation at a time when this woman is expecting the nurse to be defensive, can really transform the situation. The seventh skill, it's more complex, and I'll try to give you the sense of it, is called say it again with heart. And this is for situations when you've done all you can and the person is still not satisfied. It's a time when we need to hold our ground. We have to back down because if we have a good reason to do so. It's a time sometimes we have to say no. Is always with heart, always with caring. So a quick example, I don't know if there's no smoking in your hospitals, and in the United States now there is no smoking in hospitals. So, and yet people who are smokers push, nurses and doctors to be allowed to smoke. So let's say this gentleman says, but I've got to smoke, I'm a smoker. The nurse says, gee, I'm so sorry. For the health and safety of our patients and staff, there is no smoking here. So that's the bottom line statement. For the health and safety of our patients and staff, there is no smoking here. And that's a much better statement than saying we have a policy against smoking, because patients and families hate the idea of us having a policy. They know people break policies all the time, and they expect to be allowed to be an exception. So that doesn't work, to say it's against our policy. The best you can do is, with positive intent for the health and safety of our patients and staff, there is no smoking. But this gentleman is a smoker, so he says, come on, you don't understand. I've been smoking for 35 years. I've got to smoke. So what does the nurse say then? Because she can't back down. So she says, she repeats herself with caring. That's the say it again with heart technique. So she might say, gee, it's got to be so hard for you. That would be acknowledging feelings. Still, the fact is, for the health and safety of our patients and our staff, there is no smoking here. So she repeats her bottom line message with more caring. But this person is a smoker and they don't want to give up, so they keep pushing. Come on. Nobody's going to know. And, anyway, my doctor told me I could smoke. So then the nurse could say, well, that may be, and I feel so bad if you're uncomfortable. The point is, though, that for the health and safety of all of our patients and staff, we don't allow smoking here. So you sound compassionate. You keep using the language of caring skills to show caring, and you hold your ground on your main message. It's a very powerful skill, say it again with heart, for difficult situations. So what I've tried to do here is run you quickly through first a mental model, heart, head, heart, that is the optimal approach to both dealing with the face and at the same time showing caring through all our interactions. And then I walked through quickly 7 concrete skills for communicating with heart. And I focused on the heart skills because people tend to already use the head skills so often and even get more training in them. The bottom line, caring gets lost in a sea of tasks and procedures. And people don't know we're caring unless we communicate that caring. By using the language of caring, we can ease people's anxiety. We can personalize our care and service. We can win people's cooperation, and we can really improve the patient, family, and co-worker experience. And that is going to be a source of pride for us, pride and satisfaction and self-fulfillment for us as well. So now what? How can you help your team speak the language of caring? You can train leaders, managers, and supervisors first in the language of caring skills. You can focus on concrete skills then and build one skill at a time with an introduction to the skill, practice in people's everyday situations, some feedback, and some help sort of coach people to a 5, coach people to mastery of the skill and handling their everyday situations well. And then help people practice so that those kinds of responses, heart, head, heart, become habit in their everyday situations. And to keep it going, obtain feedback from patients and families. How do they perceive the caring of the people who are serving them? And feed that feedback back to the staff so that they keep working on getting better and better and better at caring communication. So here ends the webinar. I'd like to close with a heart, head, heart message for you and then invite questions. You know I can be sure that the people in this audience are very caring people, and you want to do right by others. That's why you chose to go into healthcare. You have, and I totally respect you for that, and I admire it. I hope that the language of caring sheds some light for you on how you can make sure that people combine task-oriented communication with caring communication so people earn the respect that they deserve for being caring people. Thank you for attending tonight, and I look forward to your questions.
Hello, Ms. Leebov.
So, oh, yes.
Hi, we have one question from one of our attendees, from Piyush Kumar. Okay, so the question is, how communication through technology can help in the patient engagement? In-person communication is different and cannot be continuous. So how, through mobile technology solutions, patient is connected to caregiver, and hence what all to take care when to build solutions on mobile health applications?
That's a wonderful question, and I feel strongly that technology can be a tremendous enhancement to patient care, working along with in-person communication. Now, the technology applications need to include the language of caring. Otherwise, people don't absorb the information they're getting very well, and they might even end up feeling anxious by the information that they're getting through the technology. So, I mean, let's say a physician is sending an email to someone, you know, with a result. Instead of saying the results were such and such, say, you know, I'm eager to send you the results. I can imagine, it's hard to wait for them. Here's what your results are, and I want to explain, what this means, since I want to prevent, you from feeling anxious, or, basically figure out heart messages to combine even in the emails. So, and similarly in applications like, apps on mobile devices. Similarly, there can be a few words of caring mixed into the text that's designed into it. And, there's no question that we don't have enough people or enough time for all important communications to be in person. I mean, that would be possibly ideal, but, technology has so much to offer. It can put people's own health information in their own hands. They can feel more control over it and can master it and ask questions and look things up. And I think that all of the technologies that are helping to engage patients have very positive possibilities. Any other questions?
Okay, so far that's the only question that we have. Thank you so much for answering. Yes,
My
you got.
pleasure.
Okay, and so for others who will have questions, we have a chat box on the right side of your screen. So please feel free to type your questions, and Ms. Leebov will answer them.
There's, without being asked the question, there's one other thing that I meant to mention, which I could mention now, and which also relates to technology. The language of caring skills are especially important when a caregiver is using a computer or a mobile device when interacting with patients. One of the things that's happened is that the more devices there are in the room, the less the provider is focused in on the patient. And so a lot of their communication doesn't feel personalized. What's the solution? Really, there's some very exciting research on this from Kaiser Permanente in California. They showed that when you're using a computer or a tech device when you're with patients, it does not work. It does not feel good to the patient when you try to multitask and take notes or read from the computer at the same time that you're talking with the patient. What works much better is mindfulness. When you're actually talking to the patient, you're not typing or looking at the computer. You're tuned in fully. And then after saying what you need to say and listening, excuse yourself to interact with the tech device, and then be fully mindful to the tech device so you don't make mistakes, so you absorb the information, so you're maximally efficient with the tech device. So you're actually, instead of multitasking, trying to do more than one thing at a time, you're being present to the person fully, then present to the computer fully, and back and forth. And when you do that, the patient feels cared about and special and not ignored, and won't go and tell friends that they care more about the computer than about me. They didn't even look at me. So that's just a very important application of the skill of presence or mindfulness as we introduce more and more technology into the patient room when we're in the exam room or the hospital room. So I hope that's helpful to people. Any other questions? Okay, well, thank you very, very much for having me. And and my email is on this last slide if anybody has further questions or wants to make contact. Thank you very much, and have a great day.
Okay, thank you so much, Ms. Leebov.
My
And
pleasure.
and for those who will have questions, we will also send an email with a link to the recorded video of this session. And you can also send us your questions, and we'll transfer it to Ms. Leebov. Again, thank you so much for attending the webinar session. If you want to know more details about the webinar sessions of Hospital Management Asia, please visit www.hospitalmanagementasia.com. Again, thank you and have a great day.